And we are here with you once again to provide an update on what's going on with COVID in Sonoma County. And we have Marcos Mejia, who works for Sonoma County in the past months. We work with Ms. Sylvia Lemes. At the moment, Mr. Marcos Mejia is making the time to be with us. And so I want to thank you for being here today. And I want to get right away to the information. What are the metrics telling us? You told us in the Spanish version that we are now in the orange tier. How do we get to the next level?
Yes, proudly, we are in the orange tiers beginning last week. And in order to get to the yellow, we need to continue with all the mitigation measures. As we know, wearing the mask, washing our hands, staying away from crowds, disinfecting, right? And as of today, I want to share with you that there have been a total of 29,608 cases confirmed in the county. And in the last 24 hours, we had 35 cases of COVID. Also, along the months that this pandemic has taken, it has caused 380 deaths in the county, with non-deaths registered in the last 24 hours. Additionally, the county has made 630,213 tests. And in the last 24 hours, 1,345 tests were made. There have been a total so far of 369,985 vaccines administered in the county.
And again, we are moving closer to the next tier. Can you tell us how we get to that level?
Yes. Well, I'm very enthusiastic with the data this week because two of the metrics are already in the yellow tier, and one of them remains still in the orange tier. But let's keep in mind that we just got to the orange level last week after only 3 weeks in the red tier, which shows an enormous progress. So as of today, for the rate for new daily cases out of 100,000 people in the county shows that 3.9 are still in the positive rate. So that keeps us in the orange tier. However, the positivity rate is now under 2%. We have 1.6%, which situates us now in the yellow tier. And it's similar for the equity metric at 1.9%, which is also below the 2% that is required to move us into the next tier, the yellow tier. As you know, Rafael, when we get to the yellow tier, the economy opens even more. So in order to get there, again, it's very important that we take care of ourselves, so that way we take care of others. We know that there are the variants of COVID are out there, and there are several of them. We know that there is not enough supply of vaccine. So these factors can put a challenge. And I want to be clear with you. You know, this progress is great, but if we lower our guard, that can send us back to the red. And we don't want that. We want to move forward. So it's very important that we all do our part.
Definitely. And so again, just reminding you, wash your hands, keep your distance, wear your mask, and disinfect when there is no soap and water available. And again, if you go to a restaurant, you're supposed to wear your mask until your food has been served. That is the safety protocol. And we are seeing that some people are not following that. And so I spent a little bit more time in Spanish. Again, we only have a few minutes to do this update, but it's important that we make that as clear as possible to individuals. And so when we talk about this, that takes us to the next question. Today is April 15th. And as a result of that, there is a change on who can get the vaccine now, starting today. Can you give us a little bit of information on that?
That's correct, Rafael. This is very happy news that today the eligibility to be vaccinated widens wide open for all the population in the county who are 16 years of age and older. Every person 16 years of age and older is now eligible for vaccination. Unfortunately, the vaccination supply is not to the levels to dispense enough vaccination right now for all these people. As you know, we are a little bit more than 500,000 people in the county. And progress is being made, but we hope that the vaccine supply will increase towards the end of April and during May. So that means that May and June, we're gonna see large amounts of people getting shots in arms.
Definitely.
But while we get there, there's going to be eligibility for all these people, and there are many ways to reach for your appointment. You can go first. You know, if you have insurance, you can talk to your primary care provider. That's the first access. Your employer may have that access too. You can go to our socoemergency.org also for information and list of the many clinics and many places where you can get your vaccine. As you know, pharmacies are also participating, and there are many entities where you can get your vaccine. There's also myturn.org where you can do your vaccination too. And if for whatever reason people has trouble to access the internet, they also can call 211 to get more information about their vaccines appointments.
Definitely. And so again, if you have regular insurance, let's say Kaiser, then call Kaiser first. Don't take vaccines away from people who cannot afford their own insurance. And so if you call the other places anyway, and they confirm that you have Kaiser, then they're going to send you back to Kaiser. So, use the tools that are available to you, but don't take advantage of other individuals. I see that we only have about 3 minutes, and I want to be respectful of your time. The other issue that I wanted to talk about briefly is if you could explain to us this information that some individuals got sick after they took the vaccine, and clarify for us that, again, the vaccine is not a 100% preventative measure for the COVID virus.
That's right, Rafael. In the county, as you know, we do contact tracing, and through contact tracing for 3,600 positive tests between January 26th and April 10th, we found that 39 of those positive cases were people who were already fully vaccinated. So that situates this between the range of the vaccine inaccuracy, although we know that the accuracy of the vaccine is of 95%, which is really high, there is still that remaining 5%. So there were found 39 cases between January 26th and April 10th that resulted positive. This is not unique to our county, it's the 1%, and we believe that other counties are seeing similar numbers. I want to tell you that of these cases, the majority presented minimal or no symptoms at all, and only one case was hospitalized, but discharged after a short hospital stay.
And again, that's what is supposed to happen. If people get sick, they're not supposed to end up in the hospital in large numbers. Some people will because of their diabetes or other health illnesses that maybe they had. But again, this is different. When you talk about the number of people who have gotten sick, the number of people who are ending up in the hospital, then the people who are passing on is not the same numbers that we had in December, November, or prior to having the vaccine. And that's why we invite the community. Again, if you live in the Roseland area and you don't have medical insurance, again, go to 777 Sebastopol Road, where the public library is at, and somebody will support you with the vaccine. Let's get everybody vaccinated for my community, right? For my family, for my community, we all need to take care of ourselves. And
That's
with
right.
that,
And Rafael, and it's important to remember the audience that the vaccine is for free.
definitely. Yeah.
And
So
walk-ins are welcome in the Roseline Library. So we encourage you and invite you to go there, to go in person, or you can call a number too. You can call 707-565-4667 in case you didn't get all the information that we shared today. I know we always share a lot of information, and possibly it's not easy to remember it all. I know I have to study all this information and put it in my brain before I talk to you. So I cannot imagine that the audience is remembering everything. So call us to 707-565-4667 or visit our website for the county, socoemergency.org. And that's, you can get much more details of all of this that we're talking here, Rafael.
Thank you for that. And as a reminder to our community, after I finish this show, this specific information goes onto my YouTube channel, Líderes del Futuro. And then we also share it in my Facebook, DACA Sonoma County. That way you can always go back, review it, take it slow, take whatever notes you need to take. And with that, I want to thank you, Senor Marcos Mejia, for taking the time and being with us today. And I look forward to a representative, whether it is yourself or Ms. Lemus, coming back next Thursday. Thank you for your time.
Thanks for your invitation. Pleasure to be here with you and with your audience again. And either Sylvia or me will be here soon the next time.
Thank you again. Take care.
Thank you. Bye.